Welcome to Module 7, Week A. We'll focus on emergency and emerging challenges. Given an emerging public health issue such as climate change or emergency situation in public health and an organizational implication, such as the H1N1 influenza, bioterrorism threats, fraud or abuse within the agency, disruption of operation, these are just some of the few examples. Identify the critical components necessary for an effective response. In this module, there will be two segments, where you'll be reviewing reading material, slides, additional resources in preparation for the module quiz, and in place of our OH conferencing exercises, you're going to complete a series of simulation exercises specifically looking at hazard vulnerability assessment, a skill-building challenge based on the pod game, and the completion of several basic preparedness training offered through FEMA. The certification that you will receive for completion will actually serve as the 14th and the next to the last tool. To complete the learning objectives and assignments for these modules, you will learn the following. You're going to be able to read the chapters from Chapter 17 from the Public Health Preparedness and Response and Chapter 8, which is the Public Health Practice Future Challenges. As our class is coming to an end, I really highly recommend that you reread these chapters and often review back to these practical future challenges because they will be milestones or just reference points for you to refer back when you're in the field working. Some of the examples we're going to showcase here, the articles, is the 1995 Chicago heat wave and the heat is on, such as the climate change and heat waves in the Midwest. I hope you have fun with this week's module simulations as opposed to what we've been doing with the conferencing exercises, which we've always enjoyed reading in response to. I think the simulation will add a little something different to what we've been doing, as well as giving you some practical experience in real-world application. Also, this is also to give you more time to work on your grand finale, your class project, which we'll go over in a little bit at the end of this presentation. So before you dive into the simulation experiments and games, let's just revisit some of the historical timelines that has shaped our public health emergency preparedness. So in 1988, 2002, that was the first Institution of Medicine report highlighting the need for this. And then also, as we all know, so September 11, 2001, the anthrax attack, some of the acute respiratory syndromes such as SARS, Hurricane Katrina. These are some examples of catastrophes that happened in the past that had played a really huge influence in the development and the creation of our preparedness that you see now. Let's remind ourselves what were some of the historical players, such as FEMA, which is the formation of the Department of the Homeland Security, and FEMA really stands for Federal Emergency Management Agency. The purpose of the Presidential Policy Directive is really to enable the United States to manage domestic incidents. And as you can see, it is really to establish a national strategy that would enable a level of public health preparedness to address these issues. As you read the material that is assigned for this session, you will see that there is many different federal planning guidelines. I highly recommend that you just at least gloss over these so that you know that these are within reach. These are very lengthy reports and frameworks, so we don't expect you to memorize all of this, but you should at least be familiar that these exist and that you know where to go find them. So what is the National Preparedness System? Well, it involves the policy and doctrine involved in ongoing management and maintenance of a national policy, such as the National Incident Management System. And it also involves planning, resource allocation, which we talked about in previous sessions, and specifically enhancing the workforce through training, exercises, and lessons learned, which you'll do in the simulation games, and assessments and reporting to really see how effective the programs and training that is specifically for public health emergency preparedness. So what are some of the top national planning scenarios. Well, here's a list of many of the top 15. So I'll just go over really briefly here what they are. So for example, being nuclear attack, biological disease outbreak, biological attack, chemical attack, toxic attack, chemical attack by nerve agent, chemical attack by some tank explosion, national disaster, earthquake, hurricane, anything with radiological attack, explosive, biological explosive, and cyber attack. So these are some examples where public health emergency preparedness really comes in handy, because you never know when these attacks are coming, but if you have a protocol, a plan, and you'd be able to strategize, okay, what will happen, what should we do, what type of resources should we allocate to minimize the harm, and so we can maximize the outcome. So the National Response Framework is really the guide at all levels of government on how to conduct all hazard planning in response to emergency. The main audience, senior elect and appoint leaders, and the results of the previous federal planning documents, such as the stakeholder investment resources, builds upon the lessons learned from past responses and disasters. So as you can see, we really emphasize that you all learn the history of public health preparedness, public health cases. So that's why we had a lot of case studies throughout this course, because the best way to plan and project what needs to be done in the future, it will be based on previous events, so that, even though the scenario, the circumstances, the players may be a little bit different, but some of the techniques, the tools, and such as the toolkits you've been collecting throughout the semester will be very applicable in these different situations. So what is the level of public health in emergency preparedness? Well, you can think of it in two different levels. There's a federal level, which is run by the National Health and Human Services, and also the local level, which is run by state and local emergency agencies, so that they can respond directly to the cause, and in case that there needs to be more funds, more resources, more personnel, the federal level can dispatch this additional funds to support these emergency preparedness issues. So some of the other areas to keep in mind that's very important is the assessment of public health needs, health surveillance, patient care, patient evacuation, public health, vector control, even with the agriculture or veterinary medical support. So these are other areas that is just as important and functional as a part of a national response framework. So let's dive into some of the agencies and what their roles are. So the CDC preparedness effort, which is PHPR, leads the CDC preparedness activity, a strategic direction, support, and coordinates the efforts within CDC and with local, state, tribal, national, and international public health partners. Since 2002, it has been responsible for providing almost $9 billion to public health departments to address these issues. Some of the goals of the CDC preparedness is to prevent, increase the use and development interventions to prevent human diseases, to detect and report the threats and any environmental issues that relates to public health, and to investigate, control, and recover what is needed to address these issues, specifically if there is some environmental safety where it needs to be immediately addressed, so such as bioterrorism, if there is a national disaster. These are environmental issues that needs to be addressed, as opposed to other issues that might be more chronically related, such as maybe mental health issues, which is an emergency but is not really as considered as an emergency preparedness issue. So some of the key issues behind emergency preparedness is to have the public perception and expectation change quickly in the face of public health emergency, right? So that they act quickly. Model to plan and organize preparedness have evolved and changed in the past years given the technology, our way of communication, such as the cell phone, social media, and getting the information out there, and the federal role in public health has significantly changed. So as you can see, preparedness resources has resulted in a stronger public health infrastructure. Therefore, we're able to be more prepared in the face of all these different disasters. So here is a diagram that shows what are the different levels and different types of all hazard events that has occurred, and what is the level of response is needed to address these different issues. I just gave you a really brief history about emergency preparedness in the United States. The best way for you to really dive into this area is to go through some simulation games. So the pod game is where you will go through this exercise, and the goal is to exceed a 1,500 person process per hour after 5 minutes of playing the game. You can try it out a couple times and just see how the game is. I don't want to give it away, but it should be a fun simulation. So here's some questions to think about as you're working with your community. So let's say the community response needs, right? So given the scenario, what are the highest priority issues that the community would need to address? What would be the most important needs? What is the capacity of the community to address this issue? What are some unique, innovative solutions that we can come up to address the immediate needs? And what are out-of-the-box way that we can address these needs? So these are just questions to really think about, as you're going out there in the field. And what about facing mounting search and rescue needs with experts unable to get help? What creative, innovative, alternative solution can we identify to safely assist the whole community locating and rescuing a missing and trapped person? So these are questions to really help you think about how can you utilize the resources that you have, or to find resources to help you address the public health emergency issue at hand. So for your final report presentation guideline, you would take in a form as a memo from your planning team to the Board of Health. So this is the overarching project that we've been planning since the beginning of the semester, right? You had 100 days, you had to figure out a plan for full accreditation. So in addition to the actual report, which can't be more than 1,500 words and also include references, the second deliverable after the memo is the presentation. Each team will make an oral presentation using the VoiceThread. The VoiceThread is a tool that allows you to record your comments or your narrative to your PowerPoint slide asynchronously because it is used through the Blackboard site. So there's no emailing back and forth, different audio files. Everyone will record their section of the PowerPoint slide using VoiceThread. We've made a tutorial on how to use VoiceThread on the Blackboard site, so everyone has an opportunity to practice. So for example, there's a YouTube video that I made that shows how to create a VoiceThread. And the second part is then how to record your own comments or your narrative onto your VoiceThread presentation. So to practice the VoiceThread commenting, which is recording your audio, I want every student to record a comment to the question, what is your favorite color? So when you go into the Blackboard site and you launch into the VoiceThread presentation tab, you see the VoiceThread video, which goes over the actual video of how to make the VoiceThread. And then the second part is the question, what is your favorite color? And you will see that you can either record a comment by text, right? Or either record an audio through your microphone or through a phone. If you don't have a microphone that's working, Blackboard allows you to record your audio through the phone. And third is a video cam. So you can even record yourself making a comment using your video. So that's the beauty of using VoiceThread, because it adds the human dimension to a presentation. Because oftentimes when we're presenting, when writing, all we see is text, and there's a lot of text. Now by enabling us to be able to provide our own voices to these comments, it adds a more personality to the actual presentation. So we decided to include this as part of the final presentation so that all the students can get to know each other, because I know a lot of students are are working remotely and haven't even met their fellow classmates. So this is a great opportunity where every student can participate in this project, record their narrative, and it'll be automatically pasted together as it would be like a normal presentation. So we hope you enjoy using this tool, because we're going to be using this tool more frequently in the online courses. So we really enjoy teaching you throughout the semester, and we really look forward in seeing your presentation. Thanks.